It's Great Day Houston.
Yeah, oh yeah! You weren't watching just any show.
That's right. Just right, al dente.
From celebrities, food, fashion, health, and more.
You've got to change your lifestyle.
Exactly.
Wake up with your morning cup of fun with your host, Deborah Duncan. Great Day starts now.
And welcome to Great Day. I want to say good morning to Juan Martinez and Leslie from the Get Wrapped radio show. I was on the show with them recently, and they asked their listeners what makes it a great day. Some said a day at the beach. Someone else said an expensive meal that you get for free. I'm down with that one. But a lot of people were just thankful for waking up and feeling good. The show today is about feeling good and looking your best. But that's tough if you have some medical issues. So today the doctors are in, and we hope by the end of the hour some of you will find the answers you've been looking for. Our panel today covers a wide range of doctors. Dr. Terry Alani is a dentist. Dr. Richard Laconi is an emergency medicine and anti-AIDS specialist. Dr. Wayne Alani, that is not her husband, that is her brother. Dr. Wayne Alani is an orthopedic surgeon, although you had somebody argue with you that
oh, yeah, in the office.
Yeah. They said, no, that is your wife,
They
as
did.
if you would not know who your own
Right.
wife is. Okay, and Dr. Jack Chapman is an interventional pain management specialist, and Dr. Joseph Perkinson is an expert in men's health. Please welcome them all to the show today. All right, we're going to go straight to our audience members who have a lot of questions for you all. This is great. You didn't have to make an appointment. You just came on down, right? Okay, so let's start with Lavonda, and your question is for Dr. Chapman.
Hi, good morning to everyone. My question to you was, I wanted to know if migraines could be genetic. I have a 14-year-old that's starting to develop a lot of serious headaches. They keep saying it's sinuses, but it's just not going away.
Yeah, and there's could be a difference between a migraine and a sinus headache.
Absolutely, yeah. Migraines are, of course, very severe headaches. They're debilitating. They're usually associated with nausea and sometimes vomiting, light sensitivity. And LaWanda, the short answer to your question is, yeah, absolutely. There's definitely a genetic predisposition.
Thank you so very much.
You bet.
All right, let's go for this question is for Terry Alani, and this is from Christina. Hi, Christina.
Hi, good morning.
Good morning.
I just wanted to know how much is too much teeth whitening, and what are the effects of doing too much?
Yeah, there are a lot of people I know, Dr. Alani, who do multiple things, you know, over the counter, go to the dentist, all that type of stuff.
Anything in excess is not good for you. That's just an adage that you really have to practice every day. So basically, you don't want to overdo whitening. The most effective, of course, is the in-office whitening that's done under a dentist supervision. A lot of people do the home whitening. Basically, we recommend doing that in the beginning, maybe for 2 to 3 weeks, and then after that, you do not want to do it all day, every day. It will cause sensitivity in your teeth. So basically, after you've had that initial whitening, then you can just touch up possibly maybe once a night every 2 weeks, maybe every 4 weeks, 6 months, whatever you need, but do not do it every day, all day. It's just not good for your teeth.
All right.
Thank you so much.
And you have a polite audience today. Thank you so much. Okay, Jamie, you have a question for Dr. Wayne Alani.
Good morning. I'm having problems with my elbow, and they told me it's tendonitis. Is there any alternative besides surgery?
Oh, yeah, that's a great question. There's a lot of alternatives. If it's on the outside of the elbow, which is there, it's usually tennis elbow. There is cortisone shot. You can do that. That's temporary relief. You can do what's called PRP, which we've talked about on the show before, which is platelet-rich plasma, which is taking a little bit of your own blood, which I know sounds terrible, but it's not.
Yeah, well, it's your own blood. There's no rejection factors.
Right,
you just, know, safe.
Spinning it down, taking the platelets out of the blood because they have healing properties, and then injecting them into it. A lot of times that will actually heal it without surgery. So yeah, there's a lot of alternatives besides surgery.
Yeah, and you're very conservative with surgery. The reason why is it can cause other problems.
Exactly.
So you just want to make sure you do as least amount of trauma to the body as possible.
Right.
Okay, did you want? Sharon, you have a question for Dr. Laconi.
Good morning. Is there anything over the counter you can take for hormones?
Hormone replacement, I guess, yeah.
Replacement. Well, you know, that's a great question because there's a lot of confusion, and vitamin store type supplements that are alleged to relieve menopausal symptoms and perimenopausal symptoms. A lot of these are herbal agents that may or may not have some hormone-like effects, but in the end, none of these are really a substitute for a bioidentical hormone, and they are all prescription. So really, the answer is no.
Yeah.
There's really not anything out there.
And it just, when you say bioidentical, it's like the body has no idea, it's not producing its own in a sense, right? Like I've seen like these things like this plant stuff. Take this plant stuff and you will get through menopause fine.
Exactly.
And I'm like, really?
If it's from a plant, it's not human.
Yes.
And there it is,
Yes.
you know. Yeah.
Okay. And this question is for Dr. Perkinson and James. What's your question, sir?
Good morning.
Good morning.
This is a three-part question.
Oh, okay.
All right.
You'll take us to medical school here.
What causes low testosterone? Can you prevent it? And if not, what do you do?
Okay.
That's a good question. Thanks, James. I think the causes of low testosterone are incompletely understood. Like aging, it's an inevitability. A woman will go through the menopause. A man will go through a change of life as well, although much slower. As to preventing it, obviously a healthy lifestyle is good. There's no one cure to slow the decline, unfortunately.
So basically it just comes with aging. It's part of aging, right?
And we're looking to identify people who age a little faster, if you will, in that regard.
About what age are we looking at for men?
Typically 40s, 40s and 50s. We're looking for people who are declining faster than other men.
Yeah. But the good news is, just like the hormone replacement, you can replace it, right?
Absolutely.
Bring you back to your teenage days, sir.
Thank you.
All right. Let's go to Tebin, and Tebin has a question for Dr. Terrialani.
Good morning. How bad is ice for the teeth or on the teeth?
Oh, an ice cruncher
over
there.
Question. Not good. Basically what happens when you crunch on ice, you're actually creating fracture lines in your teeth. We see it all the time. Some patients end up having to have crowns or root canals. And the other thing that I want to emphasize is it's not just ice, it's the extreme temperature changes with things that people eat. So if you're crunching on ice, and some people I know, then they go to hot coffee. And you're basically causing a lot of stress fractures in your teeth. So basically crunching ice is not good.
What if it's a nice, soft, crunchy ice?
I like that stuff.
Yeah,
that's good.
That's good.
Yeah,
okay.
as long as it's soft, but the hard ice or anything that's really hard or extreme temperature changes are not good for your teeth.
Yeah, because I have identified every restaurant, every stop and go, whatever, around town. I'm like, the soft ice people right there.
Yeah, the soft ice I like.
Okay, let's go to some email questions that we have from some of our viewers. This first one is from Alicia, and Alicia says, is there any truth to the internet buzz that taking zinc makes Botox work better and last longer? Dr. Lagoni?
Well, you know, this is a recent development, and actually a Houston physician has published a paper in a peer-reviewed medical journal about the role of zinc in the action of Botox and whether zinc could actually augment or amplify the rapid onset and duration of action of Botox. This initial paper seems to say there may be some truth to it, but it's still basically unestablished, so possibly.
All right. This next email is from Robert. And Robert says, I wake up 3 to 4 times during the night having to urinate. What could be causing this?
That's a very common problem for men as they get older. Probably the most common reason is the benign enlargement of the prostate gland. Men have a little gland that sits right below their bladder. It's about the size of a walnut when you're a young guy, but as you get older, it grows gradually in size up to maybe a lemon. And this blocks urine's ability to pass. As a result, you end up having to go more frequently to get rid of the urine that you do have. It's very common. It's actually treatable. There's several medicines that work very well for this. It's a big issue with men as they get older.
Okay. Let's go to this next email. This one's from Jan. Is it true women suffer from migraines more than men do? And why? Because I'm adding this last line, this is just not fair.
Yeah. Well, unfortunately, it is true. Yeah, it shifts. So boys tend to have more migraines growing up, and then going through puberty, the transition occurs, and women sort of take over at that point.
Is that because women are more hormonal?
It is. It's an estrogen effect. So that's why we see sometimes with menopause, women, their incidence of migraines will start to lessen a little bit.
All right. Well, our doctors are heading to the computers to answer more of your medical questions from home. You can email us at greatdayhouston@khou.com or send us a tweet at greatdayhouston as well. Are you ready to get on the Botox bandwagon? Which celebrities are riding shotgun already and which need to book an extra seat? We'll share some juicy Botox secrets next and how you can look ageless as well.